Good morning. Today is part 3 of the series of swelling, and today we are going to talk about is clinical examination of the swelling. First of all, meet Mr. Hurt. This is a patient who has come to us with a swelling. So before starting, first you have to introduce, take consent, and then exposure and position according to the site of the swelling. And that has to include the lymphatic drainage, and in case of limbs, it's blood supply. Okay, let me practice for you. Good morning, Mr. Hurt. I am Dr. Shukr. You have come for to show us swelling, and you were telling me that you have got a swelling in the area of your abdomen. If you allow me, can I examine you? Thank you very much for giving me permission. If you allow me, can I expose you? Thank you. Here is the swelling. Okay. Is this a swelling? Yes. Okay. Now you see, this is an inadequate exposure. And this is an inadequate exposure because the lymphatic drainage area is not visible. So therefore, I have to expose the inguinal region. Lymphatic drainage is going to occur over here. And I have to see the whole abdomen, which is extending up to the nipple and the axillary area. This is the minimum exposure. After that, when I'm going to examine the swelling, I'm going to talk about site, size, shape, surface, color, temperature, tenderness, and edge. Now, whenever we're talking about size, we should use anatomical terms. About size, it is usually either described in centimeter, or if something is universally known, then that object can also be told to describe the size, like a tennis ball, scotch ball, egg, and so on and so forth. Shape. Shape is said to be regular if the shape resembles something. If it doesn't resemble something, then it is an irregular shape. And the regular shapes could be a spherical, hemispherical, cuboid, etc. Similarly, surface is either smooth, or if it's not smooth, it will be irregular. Color is of the overlying skin, because obviously the swelling is covered by something and doesn't have its own color. Temperature, we are talking about the temperature of the skin overlying the swelling. Tenderness, and when we are trying to elicit the tenderness, one has to see towards the eye, because if the swelling is tender, the patient is going to twitch his eyes. Then we are going to talk about edge, whether the swelling has a well-defined edge or not. Let me demonstrate these on him. Since the swelling is present over here, so when I have to see, then I am going to sit down and see. Because if you see looking down, then you can appreciate the shadows much better. And since he is a male, so from the side, lower down also. So in this case, this patient has got a swelling, and swelling is present in the upper right part of the abdomen, touching the chest cage. Its size is approximately 14 centimeter. It has to be measured with a tape. If not, then one should know how much big one's hand is. This much is 14 centimeter. But please use the tape. Shape. It is at a regular shape, and the shape is hemispherical. Surface. Now I have to touch it. Now when I go to touch it, then obviously first I have to elicit the tenderness. Mister, if you feel hurt, please do tell me. I'm looking towards the eyes. It is non-tender. Surface is irregular. It's not smooth. I can feel lumps over it like you can see over here. Temperature. And the color of skin is pink. Now to see the temperature, one has to use dorsal surface of the hand. First, you feel the normal part, then keep it over the swelling. And please do not do like this fast. Keep it for some time because it requires some time for your hand skin to feel the temperature. The temperature over the swelling is same as elsewhere. It's not tender, and when I palpate it has got a distinct edge. After that, a very important thing is to know about the composition. By composition mean, is the swelling made of a solid or it has fluid in it? And if it is solid, then how much radiopaque it is, that one can find out. And if it is fluid, then how much thick fluid is, that we can find out. In order to find composition, you can see a list of tests: consistency, fluctuation, fluid thrill, translucence, resonance, versatility, compressibility, and so on and so forth. This is because any one test cannot predict the composition accurately. For example, when a swelling is soft, one may think it is a fluid in it. But a hard swelling can have a fluid in it of thick consistency, like meniscal cyst, like a cyst of the thyroid, which has a colloid, and colloid is not, as a matter of fact, that solid. Similarly, fluctuation. Fluctuation is present when the thing has fluid in it, but fluctuation can be present even in lipoma if the lipoma is very big because its consistency is jelly-like and it can move. So first is consistency. There are three types of consistencies usually. It is soft, firm and hard, and fluctuation. The procedure of fluctuation is one finger is used to press the swelling, the second finger is washed and seen does it move or not. If swelling can be held in two fingers of the left hand, press index finger of the right hand in the middle and wash two fingers of the left hand moving. Repeat test 90 degrees to it. If swelling is large, use index fingers of right hand as pressing finger and the index fingers of left hand as watching finger. Repeat 90 degrees to it. To be fluctuant, the test is positive in two planes. Now let me demonstrate these two. Now if I forget what is soft, touch your whole lip. The lip is soft. Firm, nose. Hard, bone. Let me see. It is soft to firm in consistency. Yes, it is soft. Now in order to do fluctuation, this is my right index finger. This is my left index finger. The right index finger is the pressing finger and the left index finger is the finger to be washed. Excuse me. And the left index finger is the skin to be washed. Okay? Now you see. I am placing two fingers over here. I am going to press the pressing finger. I am not going to press by the left finger, simply watch it. See. Sorry. You see? When I press, it moves slightly up. You may not be able to appreciate on the camera, but I can actually see it from this angle. It is going up. See once again. In order to confirm it is fluctuant, you have to do it at 90 degrees. And there is a reason for that. For example, if you see my thigh, as you can see over here, this is watching finger. I am pressing finger, watching, and look how well the watching finger comes up. Now, it means, does it have fluid? But we know this is muscle, not a fluid. Now, if I do like this, you see, this finger does not move. That is why to say a swelling is fluctuant, you have to do in two planes at 90 degrees. Then is fluid thrill. Fluid thrill is if the swelling is large, then you tap on one side, a wave is produced in the swelling, it goes across the swelling, strikes the wall on the other end, which is felt by your hand. If it is a fluid, it will be present. And then the swelling has to be large enough and in a fluid, so a wave is produced and wave can be felt at the other end. Let me demonstrate. Like, if this is the one, this is the swelling, I put my hand over here, and what I'm going to do is slightly. You can't see, but I can see fluid thrill on this side. One thing you should observe is that if I do, you can appreciate the wave is passing through the anterior abdominal wall also. In order to stop that, to give you false result, then the best thing to do is ask the person to keep his hand in the middle, over here, to stop that. Resonance. Resonance, the sound of a solid is always dull, and if there is an air, it is resonant. So let me do percussion on this swelling. It is dull. Now once I have done that, I want to find if this swelling is pulsatile or not. To see pulsatility, you have to keep two fingers onto the swelling at the maximum diameter which you can feel and see how the fingers move. If the fingers are moving, then there are pulsations. The pulsations could be transmitted if the swelling is lying over an aorta, or it may be expanding. That's an aneurysm. So therefore, if I place my two fingers over here and they move like this, it means it has pulsation, but pulsation is being transmitted because low down the strong pulse is moving the whole swelling slightly forward. But if my fingers move like this, then it means it's an aneurysm and hence expanding like this. Obviously, I'm going to keep it like this because the direction of aorta is like here. Then comes compressibility. And because before compressibility, what about transillumination? Because if the light is going to pass through a medium which allows light to pass, then it would be transilluminant. But if the medium is such that it doesn't allow the light to pass, then it would be opaque and it won't be transluminant. So therefore, if the composition is fluid or the composition is of solid material which is not that opaque, like lipoma, etc., then it will be transilluminant. In order to do that, you have to have a dark room. But since you cannot produce a dark room, you should close the lights, and you can artificially produce the dark room by having a black sheet or an X-ray roll. In fact, when I do it like this, inside I am producing the effect of dark room. Take a torch, put the torch on one side of the swelling, put it on the other side, and then see. This is not transluminant. Then there are two things. One is compressibility and one is reducibility. For a swelling to have these, the first thing is when you press the swelling, it should disappear. When you press the swelling and with the pressure, it disappears. Then to comment it is compressible or reducible, what you have to do is leave the hand. Once you leave the hand and swelling appears on its own, then it is called as compressible, and that is a sign of vascular swelling, like hemangioma. But if you press the swelling disappears and it does not appear till some stimulus is given to it, like that may be a cuff, that may be gravity. As in case of hernia, then you call it reducible. Then is bruit and fluid thrill. Whenever a fluid is going to pass through something, it is going to cause vibration of its wall, and that produces sound. If the sound is felt, that is called as thrill, and if you hear it, then that is called as bruit. So you have a stethoscope, and you always hear the bruit with the bell and not the diaphragm. If you place your hand, you can actually feel the fluid going through it, then that would be a thrill. After that, you have to see its relation to the surrounding tissue. Like in this case, the skin is normal. Now, if this would have been present on the limbs, then it might have effect on the vessels and nerves. So therefore, you will have to see the arterial supply of the limb, the neurological status of the limb, and then its effect on the lymph nodes. Are the lymph nodes enlarged or not? Because in inflammatory diseases, there could be lymphadenitis, and in cases of cancer, there could be metastasis. So in this case, I am going to see the inguinal lymph nodes, and it is on this side, especially axillary lymph nodes on this side. Patient does not have enlarged lymph nodes. That is how the examination of the swelling finishes. So therefore, if some examiner comes and asks me, tell your clinical findings, first I am going to tell about the history and then the findings, and I will tell, usually they say clinical features, so it includes history also. This patient has a swelling. He noticed this swelling 1 year ago because he developed some pain over it. So that brought his attention to the swelling. The swelling has slightly increased in this time period. The associated symptoms, in addition to pain, are itching over the swelling and burning sensation. And this pain becomes more after eating. Previously, he has shown to a doctor which has given him some medications, and he doesn't remember which these medications were, but that has no effect on it. And he is worried that it might be something dangerous. On clinical examination, there is a swelling which is present in the upper right portion of the abdomen up to the right costal margin. It is hemispherical in shape. It is hemispherical in shape, and it is non-tender. Its surface is smooth. Its edges are well defined. The temperature of the skin is same as elsewhere. It is soft to firm in consistency. Fluctuation test is present. Fluid thrill I could not elicit because the swelling is not large enough. It is not transilluminant. There is not compressible. There are no pulsations. The guinal lymph nodes are not enlarged. Since this swelling is in the abdomen, so therefore we have to also determine whether it is in the subcutaneous tissue, in the anterior abdominal wall, intra-abdominal or retroperitoneal. That I have not checked in this case, because when we are going to talk about swelling in the abdomen, we are going to do it. To tell you simply, what you ask the patient is to raise his head or leg slightly. By this, he tautes the muscle. If the mobility of the swelling becomes more pronounced, it is outside the muscles. If it becomes difficult to appreciate, it is intra-abdominal. And if it is appreciable and its movement becomes very less, it is originating from the intra-abdominal muscles. I hope this helps you in clinical examination of the swelling. In the next video, we will proceed forward to it. Thank you very much. I hope it helps you.